Most patients I see come with long-term chronic problems because as I work as a referral practice only now, they're the ones that haven't responded perhaps to conventional treatment or are on long-term medication. So it's what I call the ITCs, it's the dermatitis, the arthritis, the bronchitis, all these long-term problems, and gastroenteritis too.
Yeah, do you find the results with other dogs on acupuncture are as effective as have been with Ellie?
The success rate with acupuncture on the whole is over 75%. I mean, and that's even with quite severe problems. I'm not talking about cures, but just getting improvement in symptoms. And certainly with any joint problems, back problems, muscle problems, nerve problems, I mean, the results are often just remarkable. I just felt initially, well, I can use homeopathy instead of steroids, I can use acupuncture instead of surgery, and thought that was it. And I began to realise that health is not just about treatment. It's actually about prevention, it's about keeping healthy in the first place. And that led me on to look at diets and just lifestyle in general. And I think when you're training at veterinary college, it's a bit like being brainwashed. You believe certain things to be true and you believe that dogs should be fed on processed food. And my eyes were opened about the use of natural foods for dogs. And when you think about it, it's just so logical. Dogs in the wild don't open tins and don't cook their food, they eat raw food.
When you say you were brainwashed in college, what do you mean by that?
Well, it's a little bit harsh, but I mean, looking back on my days at veterinary college, we were trained to think in only one way about treatment and about feeding too, for that matter. Dogs are supposed to be on processed food, which is ridiculous. What worries me particularly is that these days, lecturers in nutrition at veterinary college are funded by the big dog food manufacturers. And to me it's just appalling and completely reprehensible that lecturers are giving lectures on nutrition funded by dog food manufacturers. I mean, it just seems ridiculous to me. How can they give an unbiased lecture on nutrition? And I remember the first time I gave my dog a raw chicken wing to eat. Now, she was about 6-7 years old at the time, and she'd been fed on dried food all her life. And I gave this raw chicken wing, and she looked at this, and she sort of stood back a bit, and she licked it. And then suddenly, if a dog can smile, she smiled, this great expression of joy spread across her face, and she devoured this chicken wing. And after that, she went on to a raw food diet. So my dogs now have raw chicken wings, raw mince, liver, offal, raw vegetables, and they don't have lots of carbohydrates, which dogs don't need because they're carnivores.
How do you feel about the practice of vaccinating dogs and cats annually?
There's more and more evidence, proven evidence, that for most dogs, early vaccination will give long-term protection. There's no need I can see for yearly boosters. In fact, it's contraindicated. I see so many patients in my practice where, when I ask where their problem began, their epilepsy or their skin problems, well, it seems to start about a week or 2 weeks after the vaccination. And every booster it gets worse again for a while. So I've no doubt, although vaccination is valuable, it is just far overused by vets. I mean, certainly the big profits in the veterinary practice are normally to do with vaccination, with surgery, and with saying lots of dog food and lots of cat food and lots of drugs. So I miss out on that side, but it's not a worry for me. I'm much happier what I'm doing now.